Actually, I'm going to start talking today on pain pathway. So basically, I'll be talking on ascending track only. So the next week I'll be focusing on descending track lah. So basically, for the pain, the pathways we use is spinothalamic and spino-reticular. So the second thing that I'm going to talk is about the gate control theory. So this one I'll talk what is that actually later on, and also on descending inhibition pathway lah. So as you see, I already explained what is pain before this. So pain is an unpleasant sensory or emotional experience due to the actual or possible tissue damage lah. So if you see there's a painful stimuli, okay, let's say we have a painful stimuli, so we call it as a nauseous stimuli. So the thing will be activated is the nociceptors. How it will be activated? Okay. So first you have anything like any chemical, any burn, or any mechanical thing that happened which caused the pain. So the first thing happen is that the chemical, there is some sort of chemical we release in our body. So it's called as mediators like that. So it has this 5-HT bradykinin, histamines, hydrogen ions, and also sometimes potassium. So there will be a cation, we call it as a cation channel, more if the potassium will be more high. So and when these things release, there will be another neurotransmitter will be activated. So this is like to alter the pain threshold. So the things will be released is substance P and prostaglandin. So this will be useful later on in the pharmaco of the pain actually lah. So on the blockade of the nerve receptors. So nociceptors will be activated. So what is nociceptors basically? So nociceptors is a free nerve endings lah. Okay, so these things happens in peripheral nervous system. So and if you want to talk about ascending tract, so what is tract? Basically, tract is a bundle of axon that passing the information from the peripheral nervous system to the central nervous system. So the same goes to the with the common termination and common origin lah. So the descending tract will be the other vice versa lah. So for now, as I explained on the fibers. So the fibers is the one passing all the informations from the down to up. So what are the fibers I already explained. So we have 3 fibers, A, B, C. So on the fibers I already explained on last week what is the propagations, the speed, and the myelination. So based on the degree of myelination, so A, delta and C. So we take these two as a comparison lah. So A delta is usually the speed is the highest one, and the C one is slow speed, and the A delta is myelinated, and this is unmyelinated. So so when we talk about this, A delta, the type A usually passes like a fast pain, and the C one is always passes a slow pain. So what is the difference between a fast pain and slow pain? So the fast pain usually will pass the pain to the brain like within 0.1 second like that. But if you see the C, usually it will take hours like that. So 1 to 2 hours like that. So basically fast pain, we will tell about this, the pain will be like very sharp. So very sharp, and also if the C will be very dull kind of pain lah. So it can be this can be like a visceral pain like that if the C lah. So because it's dull in quality, right? So okay, then after that we're going to talk on actually there is this is like a spinal cord, and it's a section of it lah. So I apologize first because my drawing is terribly bad. And this is like how the fibers going to pass from outside to inside to the central nervous system lah. So the central nervous system comprises of spinal cord and also the brain. So pass to the spinal cord, then to the brain. So what are the things in spinal cord makes the how it will be going up to brain? Actually, I will explain soon. So first we'll go to the dorsal root ganglion. Okay, there is actually a part. So we go to the dorsal root ganglion. So from the dorsal root ganglion, it will go to the dorsal horn of the dorsal horn. Okay, so this is the dorsal horn. So actually, this is a white matter. This is a grey matter. So this is a central canal. So basically, the white matter brings all bundle of axons. So if grey matter is all collection of the cell bodies like that. Okay, so basically it will the first order neuron. Okay, so we say this thing go out. Okay, first order neuron. So then after that we go to the dorsal horn. So okay, this is the dorsal part. This is the anterior part. This is the lateral part. Okay, so the fiber will pass from the dorsal horn. So means will pass to the lateral side via contralateral pathway. So means fiber will go to the lateral side, and will pass to medulla, and from medulla will go to pons, and from pons will go to midbrain, and from midbrain to thalamus. Okay, so that's the pathway, we call it as spinothalamic pathway. So there is the pathway, the fibers that are bringing up this information, we call it as spinal lemniscus. Okay, so it will be a collection of information. Besides this pain, there will be a fruit, touch, and all this vibration and all that. So all these informations, we call it, they will bring up, so we call it as spinal lemniscus. Okay, if this is spinal lemniscus, so yeah, I didn't draw, so yeah. This is about the spinothalamic. So why is it thalamic? So when it goes to thalamus, so this is what will happen now. So there is a thalama, so there is a thalami here. So the fibers are already here. Okay, fibers already reach the thalamus. So there is an intralaminar, both sides. So, and this one is like we call as a nuclei here, VPL, ventroposterolateral nuclei. So the fibers will, the fast pain, okay, like the A delta, will travel to the VPL. So then pass to the cortex straight. However, if the slow pain usually will pass through the intralaminar. So from the intralaminar, it will go to the internal capsule. So this is called as internal capsule. This is called as, okay, this is a lamina. This is called thalamus lah. So this is internal lamina, and this is the nucleus lah, and this is the intralaminar. So the fast pain will go straight to BPL and to the cortex. The cortex is like they go to post-central gyrus, and then it will get the information, and it will try to start reading, interpret. So if slow pain usually, so if it's slow pain usually from intralaminar to intracapsule to the cortex lah. Okay. So there is a few parts actually that involve in our pain. Okay. So pain related emotion. Usually cingulate gyrus is the one involved lah in the brain. So if insula is in our part of brain. So it's called as a limbic system lah. So if insula usually autonomic purpose. So what if we already have a pain? So what is the what the body will react to? So usually usually they have vomiting. If you have too much of pain, so you can have a vomiting, like you will be sweating, okay, and you will be like very you'll be sweating, vomiting, nausea. So all this is involved with the insula lah. Okay. So then this is about the spinothalamic lah. So how about the spino-reticular? So if spino-reticular, what is reticular? In our if reticular, basically it talks about consciousness in our body, consciousness in our brain lah. Okay, so when we talk about consciousness, so basically when there is a pain, so this reticular will be activated. So when the reticular is activated, and it will pass the message to the thalamus. So that is called the spinal reticular lah. Not to thalamus, sorry, to the cortex. Okay, so this somewhere here actually okay, sorry. So this is the reticular formation. So once the fibers is being passed, okay, so okay, basically this one always involved with the sloping also lah. So sloping, okay, the fibers from sloping will activate, okay. Then from the reticular formation, it will pass to the cortex fluid, the postcentral gyrus lah. Okay, so that is about the spinal reticular. How about this gate control theory? This gate control theory is brought by this Merzak and Wall at this 1965. So what they said was that they can reduce the pain sensation by introducing another sensation. So means they bring the another sensation, means touch. So when there's pain fibers, I mean the nerve fibers is going in, so there will be another touch sensation will be at the same will be releasing, I mean there will be a same touch sensation be going in as well. So, and this touch sensation usually will release some kind of neurotransmitters that will make the C fiber, okay, to compress. So, so it will reduce the pain sensation. So, the touch we mean is by massage, acupuncture or TENS. So, means let's say you have a pain, so you try to reduce the pain by massaging it, or you do some acupuncture or Chinese. Chinese story, you bring the acupuncture or TENS. So it will be electrical stimulation a bit, so you cause reducing pain lah. So that is about the gate control theory. So about the descent, okay, the next one I'll be talking is about the descending inhibition pathway lah. So this is like from cortex, okay, it's coming down actually lah. So we already talking about the coming up. So now descending, so it's coming down. So from cortex, so there's a periventricular here somewhere actually. So from periventricular, it will go. It will be activate. There will be a neurotransmitter released. Okay, so then you go to the periaqueductor and to nucleus remnant. What are the neurotransmitters neuron is being transmitted? This is enkephalin and endorphin. So when there is a pain, so this enkephalin and endorphin will be released from this area, and then will be going down, and then they will inhibit the pain actually. So this is kind of neurons and neurotransmitters will be released to inhibit the pain. So the pathway is this actually from the cortex to the periventricular, then equator, then nucleus remnant, and then you release this. So it inhibits the pain lah. So I think I'm all that. That's all for today.